You able to connect, Brent? Yes.
Yes.
Okay.
Good to go.
It is now 1:05. The meeting will come to order. The next item of business is the report from the Act 378 Subcommittee. The chair recognizes the person stepping in from Ms. Bambi Tomasoa. It'll be Lauren Womack for the report.
The Act 378 Subcommittee met yesterday, and we do not have any recommendations for the council to consider. We did spend time reviewing the fiscal 24 third quarter data for programs within the Office of Developmental Disability and Behavioral Health and Aging and Adult Services in ARC of Louisiana. These reports can be found linked on our committee agenda on the council's meeting webpage if you would like to review. There were a few follow-ups from our October meeting that I would like to share with you. We looked at the disparities within our regions for amounts spent on certain services, specifically personal care, attendant respite, and vocational employment supports within the individual and family supports or IFS program. 34% of all funding was spent on PCA respite funds, and 17% was spent on vocational employment supports. OCDD provided us with a report showing all districts and authorities have spent at least 10 percentage point above or below these averages. 7 out of the 10 fell into this category. This just shows that the regions are responding to requests, which may vary by region. No trends were identified. Ms. Tanya Murphy did mention a few of the districts and authorities have prioritized vocational supports over personal care and respite for various reasons, including cost and the ability to support individuals within an agency outside of home. Also at our October meeting, when discussing the year-end report for Customer Care Resources Program, or CCR, we noticed Florida parishes had an extremely low expenditure rate. The Office of Behavioral Health shared that they have a correction action plan in place for Florida parish and feel confident that these actions will ensure adequate expenditures this year. They plan to use CCR funds for wraparound services, which should increase utilization. We also received an update on the $7,000 in CCR funds being used in South Central region for marble composition notebooks. We were informed that South Central participated in an annual community event when school supplies were provided for students and families. The committee expressed concerns that utilizing this funding for a community event may take away from individuals with behavioral health needs who would qualify for this program. Dr. Salvecki with Office of Behavioral Health followed up on this concern after our meeting, and South Central stated that they would no longer utilize the funding for that purpose moving forward. We also discussed inconsistent supplies being offered in waivers and what impacts that may have on IFS funding. We heard from some representatives of the districts and authorities that report a small decrease in IFS request for incontinence supplies, but they noticed restrictions on the types of products provided in the waivers have left some recipients without the supplies best suited for their needs. This was an issue the department planned to look into. It was also noted many waiver recipients are having difficulty finding providers for their incontinence needs. And some providers who assist with IFS requests are not opting to become waiver providers due to the reimbursement concerns. Ms. Julie Hagan and Ms. Kelly Monroe said that they were gonna look into this for us, because they were concerned about this as well. Because when they were championing this, they wanted to make sure that people with developmental disabilities had a choice of what supplies best fit their needs, and that they were not required to have one size fits all in these supplies. Staff, is there anything? Okay. Does anybody have any questions? I'll do my best.
I just have a question or comment. So with the event that had the composition notebooks, I think I was like talking to another member or council member, and they said that their child participated in the event where the composition notebooks were given, and only people that were recipients of that office were invited for the school back to school event that they had. So I think the concern was that they were using the money for like everyone, but it was only for invited registered guests. So I don't want to take away from their back to school events that they have for students. I think we were just misinformed. We didn't understand the event that they held yesterday and then they just decided to not use those funds, but I don't want to discourage them from participating.
Yeah, I didn't write this.
Yeah, no, I know.
Something, no, that's something I wanted to ask staff about too. If that's like, if y'all could, did they respond to this after we met yesterday?
Yeah,
I mean, yeah, it was after yesterday. They simply just responded saying,
right.
you know, if it's a concern, we don't have to use this funding for that any longer. I mean, the way it was explained, it seemed like this was just a general open community event.
Right.
So you weren't necessarily tying Consumer Care Resources funding to an individual that put in a request and got a priority number. You were just blanketed giving out money. But I mean, certainly if it is for those individuals that put in a request for school supplies and they get school supplies, that's an appropriate use of the funding.
Yeah.
I think that's.
It's
But I have the same concern.
It seemed like it was a registered event for people that participated in there.
Yeah, because I mean, I went to both of them, and like, the original question was just like $7,000 on notebooks, and then Nicole, it was your.
Yeah, this is my reading.
And then I don't want to take away from.
So, I mean, like my kid participated in this and it was only for the families that's in the program. It wasn't open
Right.
to the public. It wasn't. They gave us a flyer. They told us to register and it was only the people that was in the actual program. Cause I didn't see no outsiders.
Mhm.
I'm not saying outside, but I didn't see anyone that wasn't that I haven't seen already up in this program, so I just was giving clarification about it, because I know it happens every single year. I don't know why they would put it under all composition books,
Right.
because there was way more in there than just that.
I think that's why.
It was way more in the supply, the backpacks than that, and they got like a full, it wasn't just composition, it was notebooks, they had basically everything to start you off with for your school. Everything to start you off with, folders, rulers, pens, all kind of stuff. They had all kind of stuff in there.
I don't know, it seems like it was just like a reporting.
I think I can't speak for them, but I just know I went to the actual event, so.
Right. And I'm like, Brooke, I don't want to discourage them.
Yeah.
Chrissy, I don't know what the process is.
So I don't understand why, like, cause this is the second quarter I've heard, like, that we talked about these marble notebooks. So I don't understand why, like, the person presenting the report at the actual committee didn't, like, 'cause this is the first I'm hearing that it was an actual event for the for students with disabilities, so I don't understand why whoever presents this during the Act 378 code, maybe they can clarify. I mean, no offense to anyone, but like, why didn't anybody else know that, oh, this was an event for this specific population? Like, we, in August, in October, we asked about the Marble notebooks, and they said they would get back to us, and then yesterday we only got a clear and no disrespect, but we only got clarification because of council member said, oh, I was at the event and this is what it was.
I think it was just, in their budget, and the person who attended did not, am I correct, did not know that what it was for.
Okay, so
So,
But I have a question.
go ahead, Eric.
My thing is about the school supplies, where it's being put out at, and I see around the nation that a bunch of churches give it out, a bunch of areas give it out in certain areas, and I won't even say school supplies, clothes be given out. So with my question is, how do I say this question is, they looking for, I mean, I need some clarification. Is this strictly for people that's with disabilities that need certain things, or is this tablets or notebooks, or is this something that would be things that's capable for people that's with disability? And because why I'm saying this is, when my child, God bless her heart, she's gone with the Lord, she needed special things. She needed tablets, she needed things that talk, she needed things was more important than tablets, paper, stuff like that. Why is we not focusing more on things that gonna help them that's disabled instead of pencils, paper, stuff like that? If I'm making clarification on what I'm saying, anybody can get in line and say, hey, I need a pencil, hey, I need this to start me off. You know what I mean?
Part of their budget, they allocated this money for that event, for children with disabilities, am I right?
Yeah, I was just gonna explain a little. So we did find out in the meeting that it is an allowable expense. They can buy school supplies at that company. That particular program, you apply, you put in your request of what you need. It could be school supplies. It could be some sort of communication device. But Bill with Consumer Care Resources is more focused on if you have behavioral health needs, not necessarily development disability. That's under the IFS, and you don't think this works out. So this is through behavioral health. That was part of the concerns in the conversation yesterday, because I think what most people took away was there was a big community event. Everybody was welcome. There were different partners that contributed to this event to provide school supplies. And we thought, while that's great, people do need school supplies. The concern is someone may have more significant needs. When we spent $7,000 for notebooks, we didn't want there to be any other requests that went unfunded because you participated in a community-wide event. And it may be the case that it was not community-wide, maybe it was just that district and authority invited all the people that they work with, but that was not explained. I would still have concerns, mostly because I think that program, you're supposed to put in a request, you're supposed to demonstrate why that is something you need. I feel like there's requirements that should be followed within the program. So I think that was a big concern of just making sure that others are not going without that might have more significant needs than someone that might need a notebook. That's the gist of this.
Only my daughter communicating to her family. And if you tell them the family to sign up, then we sign up as a family, so they want her to give an indicator. This is a special need for her to get in school and to do this, needs to do. Because if she says she needs water, if her head goes crumble, it's set up the water. If she go backwards, she's saying she needs food. So if you go into a school to buy a thing that's open, and you telling me to sign up, if you need a thing for saying, okay, tell us what you think. Y'all understand what I'm saying? If you put on a thing, saying, actually, what we see next. I mean, in that $7,000. I mean, I tell them would help. For her to get that, it's more out in the, park. Because you use the word as, she might need it more as this, I think y'all use the word as, the supply. I think open supply, food supply.
I mean, in that particular event, it was, they specifically wrote in their report, they purchased marble composition notebooks, so pen, paper notebook. And they spent $7,000 on that. With my understanding, that was their contribution to the pack of supplies that people may have received. They bought the notebook, someone else maybe bought other things for this community job.
Excuse me, this is the captionist, and anybody online, we're having trouble hearing what's going on in the room.
I don't know, if you can go to share in there, it's just access to but I didn't know they were like, just feel like a quick go there, and everybody was not allowing that information, and not enforcing, was not, yeah, I know other systems partners, but if you want to, if you go, you know what meeting was, like, you just want to get it, if you know, there's other things that were there, so.
Okay, I'm just saying what's going on in that region. Everybody.
Brooke?
I just wanted to, like going back to what I said earlier, like, I don't want any child that's part of the behavioral portion to miss out on supplies that they were approved on spending that money. So I just would recommend for us to like maybe send a letter or an email just back to them from the LADDC saying that, you know, like we were misinformed yesterday. We don't want you, you know, like, please continue to use the money for appropriate things. Or something, yeah, just like that.
Send that to
Okay.
the person that followed up.
Yeah.
It's just, we could get more clarity. I think I share different concerns, but
Yeah, it was a lot of money to spend for
Yeah.
the notebooks, but I don't want them to not buy anything at all for, you know, maybe a lesser amount. But I don't want them to just totally pull out of the event and reduce resources for.
Is there any public comment?
No.
Maybe there could be a way to where they could like send out a survey asking what people's needs are and meet the highest needs first and like go down the list.
I think she said they did have to fill out. some.
Yeah, we had.
And that's what you're supposed to do.
Yeah.
Put in a request for what your needs are, and they give you a priority level.
Mhm. They did that.
1 is the highest priority, 2, 3, 4.
It should be fine, right?
So they did, do the reporting correctly, like they need to fix that.
The report requires no action and will be placed on file. The next item of business is the report of the Self-Determination Committee, Inclusion Committee, Community Inclusion Committee. The chair recognizes Brooke Stewart for the report.
The Self-Determination and Community Inclusion Committee met yesterday and has one recommendation to present to the council. We received a lot of great updates from the Office for Citizens with Developmental Disabilities, or OCDD, Department of Health and Medicaid. A lot of the information shared is included in their agency reports, so I encourage you to review those for more information. And a lot of this will be included in the agency reports coming up later. So I'll let those agency reps speak for those things. The committee did receive an update from Families Helping Families of New Orleans as a follow-up to our discussions at the last few meetings. As you recall, we voted to place the center on probation for fiscal year 24 due to concerns in their legislative audit. Essentially, their funding has been reduced by half for this year. They have also been submitting financial documents, policies, and quarterly reports, sharing what progresses have been made over this year. While the committee agreed the center was making some improvements, there were still concerns for management and functioning of the center, especially given the results of their most recent legislative audit, which found similar issues to the year before. The center director expressed the continued struggles due to lack of funding and expressed concerns that staffing may be greatly impacted should funding not be restored. Thus, the committee felt some funding should be restored based on progress, but not all funding, until the fiscal year 24 legislative audit is complete. That should come out next March or April. This additional funding would be contingent upon additional dollars being appropriated by the legislator. Thus, the Self-Determination and Community Inclusion Committee recommends restoring $28,000 to the Families Helping Families of New Orleans, FHF NOLA budget in fiscal year 2025, with the opportunity to receive full funding in fiscal year 2026, pending positive outcomes of the center's financial audit for fiscal year 2024, and is offering this to the full council for consideration. Unfortunately, we ran out of time to review our contractual updates, but those can be found under goals 1 and 2 in the status of planned activities report in your blue council meeting folders. You can reach out to staff if you have any questions about particular initiatives.
So it was moved, thank you, Brooke. It was moved to, the Self-Determination and Community Inclusion Committee recommended restoring $28,000 to Families Helping Families of New Orleans, FHS NOLA budget in fiscal year 25, with the opportunity to receive full funding in the fiscal year 26, pending positive outcomes of the center's financial audit for the fiscal year 24. Because this motion comes from a committee, it does not require a second. Is there any discussion from council members?
Just more questions, and I don't know if you'll be able to answer them off the cuff, but so what amount of money do they have for the current year? You know, I mean, I see the 28,000, okay, but I don't know what that is compared to their.
They were.
Yeah, 50, it's 56,930, 931 that they get, all centers get that amount. We received an additional $500,000 in our state general fund last year, so everyone would have got an additional 55,555. So that's the amount that they were cut, that 55,000. And that amount was divvied up amongst the other FHF centers. So this motion, out of that 55, assuming the legislature appropriates that additional $500,000, 28 of that 55 will be given to them until that next audit comes out to see if they've.
So just the concern that I have is well, whether it's, poor management or whatever the reason is, I mean, ultimately, aren't the parents and families of children, youth, whatever, in greater New Orleans or the area there, aren't they the ones that ultimately are being kind of punished? Is that addressed somehow? Or?
So yesterday, when Aisha came and spoke to the Self-Determination and Community Inclusion Committee, she let us know that despite the limited funding and lack of support, they have done even more than they had before. So
Guess not.
yeah,
That was just a concern,
Yeah.
like, oh.
I mean, we thought that too, but based on the reports that she gave, she said that she was doing just fine.
And she said was something about. And she has her hand raised.
She is joining us
Like-
virtually. If y'all have questions or if she has something to share.
Is there any public comment? Yes.
Yeah, Aisha, you should be able to unmute.
Can you hear me?
Yes, ma'am.
Oh, okay. I'm sorry. Thanks for recognizing me. And I want to apologize for not being there in person. Yesterday, I found myself on the side of the road. My car stopped after I left there. So it's in the shop, but I just wanted to respond to that. As I told the committee on yesterday, that although we had the cut in funding, we still wanted to make sure that our families could still receive quality service. And so what I explained to the committee was that I gave up my salary, the bulk of my salary, to ensure that my staff would still have a living salary and still be able to do the work. There was a lot of things that I did cut from the budget so that we can continue our work and then also continue to move forward with doing more, because of course we had that time during COVID where we didn't do a lot. And so we wanted to do more and making sure that everybody is still receiving the services that they needed. And so I have a really great staff who will not ask for travel or those types of things. And so we're just really, really committed to doing the work and committed to the people that we serve.
Are there any comments in the chat?
No comments.
Right. So we're ready for the question. The question is that the Self-Determination and Community Inclusion Committee recommended to restore $28,000 to Families Helping Families of New Orleans budget fiscal year 2025 with the opportunity to receive full funding in the fiscal year 2026 pending positive outcomes in the center's financial audit for fiscal year 2024. We will have a roll call vote. If you're in favor of the motion to restore the $28,000 to Families Helping Families of NOLA, pending the positive outcomes of the audit for the fiscal year 2024, when your name is called, please say yes. Or if you're opposed, say no. If you abstain, say abstain. Hannah?
Ms. Aduli,
Yes.
Ms. Aduli, yes. Ms. Avera,
Yes.
Ms. Avera, yes. Ms. Banks,
Yes.
Ms. Banks, yes. Dr. Baravecchio,
Abstain.
Dr. Baravecchio, abstain. Ms. Bayham, Mr. Billings,
Yes.
Mr. Billings, yes. Ms. Crane, Ms. Hagan,
Yes.
Ms. Hagan, yes. Ms. Hano,
Yes.
Ms. Hano, yes. Ms. Harmon? Sorry.
Yes.
Ms. Harmon, yes. Ms. Heimel? Ms. Jordan?
Yes.
Ms. Jordan, yes. Ms. Moore? Ms. Nguyen? Ms. Perrodin?
Yes.
Ms. Perrodin, yes. Mr. Piontek? Mr. Piontek? If you could unmute to give your vote.
Thank you.
What was your vote, Mr. Piontek?
Yes.
Mr. Piontek, yes. Ms. Richard?
Yes.
Ms. Richard, yes.
Mr. Roca?
Yes.
Mr. Roca, yes. Ms. Singletary? Abstain. Ms. Singletary, abstain. Ms. Stewart?
Yes.
Ms. Stewart, yes. Mr. Taylor?
Yes.
Mr. Taylor, yes. Ms. Washington?
She's not.
Oh, we just
Oh,
lost
we
her.
just lost her.
Ms. Webb?
No.
Ms. Webb, no. Dr. Wilson?
Yes.
Dr. Wilson, yes. Ms. Lauren Womack?
Yes.
Ms. Lauren Womack, yes. Ms. Tangela Womack? That's 16.
16 yeas, 1 nay, and 2 abstain.
The yeses have it, and the motion is passed. The next item, the report. I'm sorry. The next item of business is the report of the Education and Employment Committee. I'm sorry. We have the standing council members' reports. They are in your packet. Our first report is from Louisiana Rehabilitation Services. The chair recognizes Courtney Ryland.
Good afternoon, everyone. I'm Courtney Ryland, Bureau Administrator with Louisiana Rehabilitation Services, filling in for Ms. Melissa Baham. In your packet, is the fluorescent hot candidate report that cannot be missed. And just for time's sake, I'm just going to hit on the high points, and I will absolutely answer questions that I can. So for pre-employment transition services, right now, LRS is providing services to 4,382 students statewide. We currently have 16 third-party cooperative arrangements with individual school districts throughout the state, but we are already coordinating with Webster Parish and Lincoln Parish. So we will be adding some more third-party cooperative arrangements. And then for the consumer statistics for serving consumers through vocational rehabilitation, just want to make note that as of March 31st, we have 9,439 cases open just in VR. And then we have 3,684 cases open just in pre-employment transition services, minding my ABCs.
That's the 11th and 12th grade, is that correct?
Well, yeah, 16 and older.
16 and older.
Yeah. Then the next chart is regarding open cases that are just for consumers who have been identified with developmental disabilities and the totals for those. So for those who have been identified with autism, we currently are serving 810, with cerebral palsy, 159, and with intellectual disabilities, 658, and for specific learning disabilities, 1,209. So that's a total of 2,836 individuals that have been identified with those specific diagnoses. For closed rehabilitated cases, you can see the next chart. We have closed a total of 45 cases, and that's just from January 1st through March 31st. Then the next chart is regarding our rehabilitation employment development specialists. So just to give a reminder, those individuals that are employed with LRS, they are basically job placement counselors that are just for LRS consumers. So they're working with LRS consumers and they're working in the communities trying to develop placement opportunities to make sure that our consumers get served. Right now, we only have REDS, what we call REDS, in regions 1, 4, 5, 6, and 8. Region 3, which is our HOMA region, has not had a REDS in quite a while. Region 7, the Shreveport area, lost their REDS about 6 months ago. And then as of February, the REDS in the Baton Rouge area, which is 2, was actually promoted. So that created a vacancy for that position. With regard to administrative services, I'm actually also the LRC, Louisiana Rehab Council Liaison, and we will be meeting next week, Thursday, the 25th, in Lafayette, Louisiana. And we've got our meetings posted on the Boards and Commissions website and the LWC website as well. Louisiana Rehab Services also employs our own community partner work incentive counselor who is assisting our consumers who receive SSI, Social Security insurance, or Social Security disability insurance. And she has provided services to 40 of our consumers since October 1st. And we are still sending referrals out to Lighthouse for the Blind and LSU Human Development Center for consumers who choose to use that as their benefits counselor instead of the LRS benefits counselor. For the Disability Innovation Fund project, there has been some changes, or there are going to be some changes. We still need some participants in the New Orleans, Baton Rouge, and Lafayette regions. They're currently funded through Michigan Rehabilitation Services, and actually that's why Melissa is not able to be here, because Rehabilitation Services Administration is at the LRS office meeting regarding this initiative. So there are things currently going on with this project right now as we speak. There's also another Disability Innovation Fund project that LRS is coordinating with Department of Education. And I believe Ms. Jordan and Bayham are going to be going to Charlotte, North Carolina next month to try to develop a strategic plan to move forward. And can also be, keep this in mind of what the purpose of this SIP grant is. And that's regarding transition resources and referrals specifically in North Louisiana. Statewide trainings. There was a statewide vendor training that was conducted virtually last month. So we updated our vendors on employment services because we had made some recent changes to our technical assistance and guidance manual and the new fee schedule, which I hope you've all had an opportunity to go to our website and view those. We also conducted a statewide training with all of our rehabilitation counselor associates. And I think this may have already been mentioned before regarding making sure that they are equipped to be able to counsel parents and students regarding pre-employment transition services to kind of alleviate some of those responsibilities from our counselors. And then, of course, the 2024 combined WIOA state plan is currently on the LWC website. They are soliciting public comment until midnight on April 26th. What's it? I'm sorry. It's the combined state plan. WIOA? Did I say WIOA? No. I didn't. Okay. Okay. So WIOA stands for Workforce Innovation Opportunity Act.
Thank you so much for absence. Are there any questions from council members on the report?
I have one. Okay, I know Marie said, and I've asked a couple times, how does one go about applying for that red job?
If it's posted on the civil service website, that's how you would be able to apply. That's the only way state employees are able to apply.
On the civil service?
I don't know that it's up there. Don't know that it's up there.
Yeah, I don't think so. So if it's not up to where someone can apply for it, how is someone supposed to apply for that job? Like, I gotta have some, because we've been with this for like 2 years. And I acted every single time.
You're talking about for the home region?
Yes.
Well, actually, we'll have to talk.
Okay, because I really have been acting for the last 2 years, like, how do we get someone in this position? How do they apply? And even when I'm on the civil service website right now, and I type in this position, not even coming up. So it's gonna like be vacant until I like it better.
Laura? I just want to say too, like, it's our opportunity to look at the LRS plan and the big LWC plan as a whole and make sure that people with disabilities are included, especially for employment. Work as a partner in that field, that's what I do professionally, and we are not even on the radar, even though we should be. It's mandated that we should be included in this. And I think it's very important as advocates that we read it and we make suggestions, because this is gonna be the plan, I think, for 4 or 5 years, correct?
Correct.
So this is our opportunity, so you can please make time to read it. Familiarize yourself with it, make suggestions, ask questions, because this is gonna be policy moving forward. The other thing is, I think, don't hold me to it, but if you go on the LWC website and you click on Louisiana Workforce Commission, there might be a place where you say, join us. And it may be on there, I might have saw it the other day.
Said the what?
On the LA Works stuff.
Oh, okay.
LA Works.gov, is it gov or .net? And you click on the logo. I'm trying to go through this and it might have a thing like where they're recruiting people to work at the actual Louisiana Workforce Commission. And I think that position was under there the other day I saw it, but I could be wrong.
Do we have any other public comment?
No.
Hearing none, the report requires no action and will be placed on file. The next item of business is a report from the Bureau of Health Services Financing Medicaid. That was from Tangela.
Mr. Brian
Oh.
Bennett is her proxy.
Was that
Brian Bennett.
Brian Bennett? Chair recognizes Mr. Brian Bennett for the report. It's the light blue. Mr. Brian.
Y'all ready for me?
Yes.
Okay. Hi, everyone. My name is Brian Bennett, and I'm presenting the Medicaid report for Tangela Womack today. I'll just go through and highlight some of the sections that are included in the report. So first and foremost, in section number 1, we talk about our unwind activities. If you've heard the term unwind, what we're talking about there is just during the COVID public health emergency, there were a lot of temporary provisions put into place. And when the public health emergency ended, we had to undo all of those. So especially related to eligibility during the COVID PHE, we didn't reassess eligibility for a few years. So about a year ago, that requirement ended for the continuous eligibility requirement ended. So we started renewals again. We've been doing that for about a year now. And I think we have one more month of renewals that are probably, I think they're slated to go out towards the end of April. And then we'll get on a cadence or a schedule of just getting back to our normal routine of sending renewals out so that everyone on Medicaid will be renewed on a yearly basis going forward. And I'm sure a lot of you have seen some of the outreach materials that Medicaid and LDH has put out there, the billboards, the radio spots, the TV spots, print media, social media. We really want to encourage everyone, not only during unwind, but going forward to, check their mail. If you get something in the mail, make sure you respond to it. And then also equally as important, if you have any changes to your contact information, address, phone number, especially, make sure that those are kept up to date on file with Medicaid so that we can reach you and that you get any of that important information that needs to be completed and returned. Another thing that Medicaid's going to be doing over the next probably month or two, we're planning to do additional outreach to those that closed throughout this initial unwind renewal period because they didn't return the request for information or the mail that was sent out to them for their renewal. So for those people that closed because we didn't get a response to them, we're going to be doing additional outreach to try to see if we can reach them or get updated contact information. And hopefully when we do our next report next quarter, we'll have some more details about that, about specifically what we're going to do to target that group of people. And then for the rest of the sections, I'll just go and hit the high points with some of the data. And for the Act 421 Children's Medicaid Option or TEFRA program, I do want to correct a typo in the second line. It says December of 2022, and that's supposed to be 2023. We've received or approved nearly 2,000 applications, and as of this week, we have 1,729 children enrolled in that program. I would also encourage anybody that wants to know more about the program, if you haven't already, to visit the Act 421 website. I think, let's see. Yeah, on to the next page, on page 4, we've included the link to that. We really try to keep information there updated, provide information for people that are interested in applying, like the various steps you have to go through. There are several steps, and it can get a little complicated, but we try to put all of that information on the website. We have some flow charts there. So there's a lot of good information on that website, as well as there's a dedicated email address. It's 421-CMO@la.gov. If anybody has any questions, comments, anything that they would like to see on the website for that program, you can email, and one of the staff will make sure to take care of that for you. Going to the section 4, the Money Follows the Person program. So this just gives kind of a historical view of the total number of transitions for the department. That's both across OAS and OCDD over time since the start of the program in 2009. A note at the bottom, recently Congress did, or about a little over a year ago, Congress did reauthorize funding for the program through 2028.
Job opportunities at LWC.
And that doesn't mean that the program's going to end in 2028. That just means that they've dedicated funding at the federal level for that program to continue operating until 2028, which is really good news, because for a little while there, the funding was kind of piecemeal together year after year. So it's nice to have a good chunk for a few years that we've got funding for. In the next section, self-direction. So at the end of February, there were a little over 2,500 people enrolled in the self-direction option. And the chart that's included breaks it up by the 4 different waivers that offer that option. Over the past, 5, 6, 7 years, we've really seen an uptick in the growth in the program, which is good. And you can also see now that we've got the 2 fiscal employer agents, Acumen and Morning Sun, the share of participants that each one of them has, that's included in that paragraph underneath the chart.
Hey, Brian, this is Mindy. I think what Ebony's showing on the Zoom, or you're showing on the Zoom, doesn't match the handout. This is as of February 29, 2023, and our handout says as of November 3, 2023. That, I mean, the numbers look about the same, so it's not that big a deal, but just, I'm not sure which one's right.
Oh, it doesn't match the fiscal handout that y'all have?
Yeah,
Oh,
make sure. Okay, yeah, let's just make sure we get the right one on file, I guess is my point. This one says January 2024 at the bottom of the page and then footer.
yeah, it should say April 2024.
Okay, so it's just the wrong handout. Okay, no problem. We'll pay attention to the screening.
Okay. And then going down to electronic visit verification. That's the next section in section 6. So electronic visit verification, or EVV for short, we've had this up and going for a few years. The Congress passed the Cures Act. I can't recall exactly what year it passed, but it required states to report certain services through EVV. So all of our personal care type services, which those are available under most of our waivers, those have been utilizing EVV for a few years now. And then most recently, at the end of last year, 2023, we implemented EVV for our home health care services. So the home health care services delivered or provided under Medicaid are now utilizing EVV to report those services. And then just really quickly also in section 7, that gives a breakdown of enrollment in our Coordinated System of Care program, or CSOC, across the state, across the 9 regions of the state. We've got, as of last month, there's about 2,265 children and youth enrolled in that program. And then finally, in section 8, for our applied behavior analysis, or ABA services, this just kind of provides a snapshot for the month of February for to get an idea of the amount of services that were used, requested, and paid out for just our ABA services. And that's the end of Medicaid's report.
Thank you, Brian. Are there any questions from council members on the report? Ebony, is this the right one since January?
We're asking them to refrain.
Okay. Hi. Is there any public comment? Since there's no public comment, the report requires no action and will be placed on file. The next item of business is the report of the Office of Public Health. The chair recognizes Ms. Patty Baravecchio for the report.
Thank you. On the goal report, and I'm going to try to convert it really small since we're running short on time, but everything is pretty much covered within. One of the things I did want to call attention to is if you guys are working with providers or have staff that are interested, our partnership with Families Helping Families, we are coming up on what we call resource information workshop season. And in the list, I think it's on page 2, you'll see there's several training events that are coming up that are open to health providers, but are really good for any public health professional. Covers things like development. We have one on trust-based relational intervention, navigating early diagnosis and therapy for children with autism spectrum disorder, introduction to trauma-informed care. So really great topics, some great speakers coming up. And if nurses and social workers can get up some, depending on the length of the presentation, but it's usually 2 to 3 contact hours of continuing education credit. And I know today, health transition has been a bit of a hot topic, and I just wanted to remind y'all, and I know it's not in my report, but we do have a family-facing website. It's really targeting the teen audience. It's called smoothmovesYHT.org. And we know that that web address is not telling. So over the next year, there is plans. It is moving to teenhealthhub.org. But that transition, if you use that web address, it will bring you to smoothmovesYHT.org. But a lot of great transition information. And like I said, it's really targeted for that young adult to help support their transition to adulthood. So, and just to let you know, I think it's a really great thing for us to take on, because I looked at the national survey, and we're at about 12% of our teens with special healthcare needs in our state are receiving appropriate resources to transition. And we're talking about the youth health transition. So I think it's a really important topic for the communities that we serve. And if another plug for the national survey, if you need any data on child health, the National Survey of Children's Health is a really great resource. They have all kind of data on the population of children and youth with special healthcare needs, children with mental, emotional, developmental, behavioral issues, family well-being. So a lot of great data in that site, and it's really easy to navigate and search through that data set.
Repeat that, the new website again.
The Teen Health Hub.org. It's going to be Smooth Moves. We thought that might be, in fact, Families Helping Families helped us determine like what was a better website than smoothmovesYHT.org.
TeenHealthHub.org.
In your.
Thank you, Ms. Bowden.
Are there any questions from council members on the report?
Are you transition? Okay.
Is there any public comment? Oh, sorry.
I just wanted to let y'all know, they did cancel that, early identification deaf hard of hearing. It's open to the public. It was the 26th. They canceled that meeting as of this morning.
Thank you for that update.
So which one was that, Samantha?
It is on that second page, or third page, I'm sorry. About 3/4 of the way down, advisory council for the early identification of deaf and hard of hearing infants.
April 26th meeting, canceled?
Yes. I only know that because I was given an update on CMB at that meeting. Thank you.
Thanks.
Is there any public comment? Hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Office of Aging and Adult Services. The chair recognizes Mindy Starr to present the report.
Okay, hello, y'all. This is Mindy. This is the peach one in your packet. And I'm not gonna read all these numbers out to you, but I am gonna flag some activities that we have going on. Just a quick update on legislative. We don't have a ton of bills from OAAS this legislative season, but in HB1, which is the state budget bill, we have requested 750 new waivers. And so last year we got 500. And you know, the limiting factor sometimes is not having enough direct service workers to be able to provide the work. The other factor is the money to pay for the waivers. But one year it'll be one problem and the next year it'll be the other. So last year we got 500. The year before that we got 500. And I'll tell you how you know where the bottleneck is because 2 years ago we were able to fill those 500 additional slots by December. This last year, we were able to fill, we are at the 90% mark. Here we are in April. So it's taken us several more months to fill those 500. So asking for 750 is a little ambitious next year, but we're making some process improvements such that we believe we'll be able to do that. So we'll be asking the legislature for the funding for that. Another bill that we have in session, if you wanted to look up on the legislative website, is Senate Bill 11. It's very much a housekeeping bill. This is for our program that's for the traumatic head and spinal cord injury program. Nationally, most organizations are named the traumatic brain and spinal cord injury. And we're just changing the name from head to brain because you can have a head injury and not have a brain injury. So we're just getting aligned with the rest of the nation on that one. There's one other bill that we have, it's House Bill 687, and that is to create a PACE program license. So PACE stands for the Program for the All-Inclusive Care of the Elderly. And just to revisit what that is for you, that is a program where the state pays a per member per month amount to these providers. The providers provide transportation to their centers. The person can go and it's like they have socialization at the center and gather for the day. They can see their doctor. They can have therapy there. It's a very all-inclusive care, and they eat while they're there. And if they get sick and have to go to the hospital, or if they have a stint in a nursing facility for rehab, all of that is paid under that same per member per month. And so everything is cared for. Right now, we have services in the Lafayette area and in the Baton Rouge area and the New Orleans area. And we're really excited to say that we are expanding into Alexandria. It's taken us almost 2 years. It's a long process to approve a provider, but we just got word from Centers for Medicare and Medicaid Services that our provider has been approved to open up in Alexandria. So we look for that program to open up in June. So if you know people in that area, if you're from that area, please look for the advertisements. It's really a neat facility and a neat concept. And so we're excited about that. You'll hear me mention about further expansion of that in a second. One of the things that happened just yesterday was every year the Council on Aging in this area does a senior skip day. And I think that's just the cutest name, right? Senior Skip Day. And but it's really grown. They've held it. This is the 3rd year. It was at the Raising Cane's River Center. And I haven't been able to download completely. Our staffs all went and had tables and giveaways and stuff. But I was texting with my folks this morning, and they said there were literally thousands of people there. So I let that be a notice to us all that the population of people who are aging is growing. If you need to know, if you need to see it, go to one of those senior skip days and you'll see it. But it's great fun, and I encourage you this time next year, if you know somebody, to please tell them about it. Brian drew attention to the public health emergency unwind. I'll just kind of add one little note on that. So every month when Medicaid runs that list, they send a list to us and we go through that list of all of our participants that are in our waivers. And our regional operations teams reaches out to each and every one of our participants to do our level best to contact them and make sure that they know if they don't get their contact and update their information, that they're going to get booted out of Medicaid. And so I will note that this last month, we actually had more people on our list than we had seen in previous months. And so I think that as we're all getting away from the COVID mindedness and we're all eager to get there, I think people may be forgetting about this unwind activity and it may sneak up on them. So please, in your organizations, please make sure that people have re-upped their contact information and Medicaid, because we don't want anyone to fall off for the wrong reasons there. Let's see what else I want to point out to you. So you've heard us talk about our American Rescue Plan dollars. Those were dollars that were given during COVID, and we've been judiciously spending that money. The money will needs to be spent by next March of 2025. And as Julie may have mentioned yesterday to some of you who were on our committee, we found out in just the past few weeks that 3 states have gotten permission to extend their funding to use it longer than next March, which would be huge for us because the bigger, more effective and important projects just take a long time to procure and to get in place. And so we're working hard to see if we could get an extension. Some of the things you all have heard us talk about with the bonuses to the direct care workers, we raised our provider rates. We were able to get that into our budget and keep those rates up high. I say high, maybe that's not the best word, higher. And so we're proud of all of that. We just recently, again, just a couple of weeks ago, got word that the request for us to do a rate study to look at what providers are paid versus the services they're offering, that was approved by CMS. So we can use these dollars. That's an expensive financial actuarial type project, and we don't often have the money to be able to do that. And so that was approved. And then for OAAS, we also, you have to audit whenever you give money out, particularly if it's federal money, you have to audit to make sure it was spent the way it was supposed to be. And one of the challenges that it is for states is because we don't have the money to do the audit, to pay people to do those audits in a financially responsible way. And we don't have the expertise to do it. Well, they approved us to use this money to do the auditing. And you'll remember that for OAAS, our increase of our direct service worker wage went up to a $9 minimum wage, but we also had a part that said 70% of the increase in the rates had to go to the worker. So we'll be auditing to make sure that employers did that. Julie had mentioned about the health, home and community-based services access rule. There is a rule that we're expecting to come out this month, by the end of the month, and it is hundreds of pages long, and it will impact how home and community-based services is managed and monitored. And there's a lot of great things in there, although it's daunting to think that we would be able to get this in place in the time frame that they've given us. But one of the elements that's in there is that 80% of the rate of the payments to providers would go to the workers. And the reason that's different is where I was just saying the rate, let's say the rate was this and it got raised to a higher rate. 70% of this increase is what we said had to go to the worker. This says 80% of the whole payment has to go to the worker. So it's going to be a real paradigm shift for our community and our providers. So we'll be working through that to make sure that we can keep those providers in business and still meet the requirements. One other thing I'll mention to you, that as we spend money and something doesn't cost quite as much as we have, we say, oh, we've got some money left over. Let's ask for some more ideas to be approved. And we have two that are cooking, I'm going to say right now, with CMS. And one of them is to provide dementia training and training on who's a mandatory reporter for abuse and neglect. There's also training that we're going to be doing on person-centered planning. You know, that's a term that we use when we talk about the plans of care, that you're not just dictating to someone what they need for care. You're asking, what is your life? What is important to you in your life? And you plan for that. And so be on the lookout. If we get it approved, we're going to use this funding to deliver this planning in widespread ways. And so I'll be sharing that. You rest assured you'll find out about it. And just to skip through some of the numbers here, one of the very important things that we just got word of, again, a couple of weeks ago, we had a couple of good news things a few weeks ago. Our CCW, our Community Choice Waiver, was renewed. It was going to be expiring in June. You have to apply for renewal, and that's been renewed. So we were pleased about that. We do still have over 4,500 people on our wait list without any services. We continue to work to find various services that those folks can benefit from. And so that we're continually trying to work into that space. As far as adult protective services go, all the numbers at the bottom, there's a couple of things I want to note with regard to APS. You'll notice that we have the 3 years, fiscal year 22, 23, and 24, and we're on track this year to have as many cases as we did last year. So that's kind of a double-edged sword, as they say, right? You don't want a lot of abuse and neglect cases, right? On the other hand, you don't want it going on and not knowing about it either. So we are encouraged whenever we see that the numbers haven't dropped off. You notice that in 22, it had dropped off some. So reporting is a good thing. So along those lines, we just went online with a soft launch of an online reporting system. You can't report anonymously on the online, and you can't report sexual abuse online. You still have to call in to report that. But we've already seen a huge increase in the reporting by people that are using the online. We're still trying to make sure all the kinks are worked out of the system before we market it out wide for everyone to know. But there is an online reporting that's available now. And we have resumed our coordinated council meetings that instruct people on abuse and neglect in the communities. And so you'll want your networks to know about that. And then the only other thing I would notice, when you look at, when we have allegations and we investigate them, they fall into these 6 categories you'll see in that chart. And I think it is really interesting that the caregiver neglect, it just stays at the top of the list every year. Almost a third of our abuse and neglect allegations are caregiver neglect. But also noteworthy is nearly 20%, or this last quarter, it was a little over 20%, is self-neglect. And so a lot of our APS investigators are really, they've turned into educators, and they've also turned into, I'm going to say, connectors. We've used some of our money through the Administration of Community Living, which is how APS gets their ARPA money. And we've used that to create kind of an account of money that when we go and we investigate somebody and we see that they need to get out of the situation and they need help, we have a little pot of money that can help us get them stable until they can get out of the situation that they're in. And that was something we didn't have before the ARPA money came. So anyway, I just wanted to flag those couple things. And I think that's about the extent of my report. Yes, sure. Answer any questions.
From DCFS to APS, does the change, because we have children who remain in at school till age 22. Is it they start with APS at 18 or is it 19?
It's 18.
They start at 18? Okay.
To 59. And then at 60, it becomes Elderly Protective Services through the Governor's Office of Elderly Affairs. But we work closely with them. I think the trickiest part about Adult Protective Services, it depends on who the perpetrator is as to who investigates it. So let me clarify. If the perpetrator is a provider, it is investigated by our Health Standards Division. They go out and they do a survey to see what's going on. If it is in the home and it's a family member or a community member, then we do the investigation. And so sometimes it's a little tricky to find out. You have to know kind of where the person is. If they're living in a facility, it's going to be Health Standards. If the perpetrator is a provider, it's going to be Health Standards. But if it's in the community in someone's home, it's going to be Adult Protective Services. And so a lot of the cases we look into are neighbors, family, coworkers who call and report something on something they've seen, or they think a child or a relative is financially exploiting the person. So those are the cases mostly that we investigate. Any other questions? Yes, ma'am.
This was just a thought, something to think on. Could your office, or if they already have one, send like the grievance process or the process to disability rights? Because if people contact disability rights, usually I know disability rights will be like, oh, here, you go here and go through the process. But if they're properly educated, maybe with like a training or just a supporting document, if they can explain the process to the individual, or is that a disconnect?
I was going to say
conflict of interest.
Yeah, it kind of is in that we have a whole intake process that, that we go through when someone reports something, and there's a lot of information that's gathered, and it's gathered in a way that provides the investigator what they need to know. And I think from our being responsible for that would mean that it needs to come into our door. But we'd be more than happy to have disability rights convey a case to us, which is what happens as many times. And so sometimes we'll get someone call us about somebody who's over 60. So we take the information and we hand it off to Elderly Protective Services. Same thing with Health Standards. Somebody calls us and says it's a provider problem. We take it in and hand it off to them. So they work really closely together, but that's another one of those things that the Health and Home and Community-Based Services Access Rule that's coming. There are a lot of standards in there that require incident reporting and how you report that up to the feds from all these different channels. And we're doing most of that already, but just coordinating it between the different events and the different facilities is going to be a bit of a challenge. So we've got our work cut out for us there, but that's a great question. I'm going to say, Chrissy, you tell me who to talk to.
The people that are on a waiting list, is there a matrix or something that y'all use to put them on a waiting list? And the people that are waiting for services, is there no one monitoring to see if their condition is getting worse? I guess my question is, how do they move up?
Okay, so
Because, you know, seeing these numbers is kind of scary.
it is.
Because, you know, there might be people that's in desperate need, but just don't know their rights on how they could move up.
Exactly. That's a great question. So, about 10 years ago, the Office of Citizens with Developmental Disabilities changed their prioritization of their wait lists. And so when you call in, they assess you and decide, you know, what is your acuity, where you need to be on the wait list. That's not the way it's done at OAS. OAS is first come, first serve. Now, what we do have in place is we do offer people, other than the waiver, we offer you other services that you can take while you're waiting. So that number 4,700, those are people who don't have anything. Now, we don't know, so there is a screening process. And when they call to get on the wait list, there are some basic questions that get asked. And we have to determine whether the person is going to be a nursing home level of care. There's some things that we ask. And so, but once they get on there, they're not really assessed like in person as an assessment until their number is called, until there's a waiver slot that opens. We did a lot of work last year because we would reach out to people and say, hey, there's a waiver, you know, we want you to come on board. And we would get about 70% of the time they never responded. And so we changed the way we do that. Now we call them when we send it. We tell them it's a blue envelope. We simplified the language and we call them once they get it and don't call us back, we call them again. So we do reach out and try to say, okay, it's your turn. And sometimes we'll find that the person doesn't need the services anymore. Unfortunately, they've been waiting a long time and now they've either moved, passed away, or they've gotten better in some cases. So we are looking at, we propose to go back and begin the work to reprioritize our wait list the same way OCDD does and get them in order of acuity. One of the things that we're looking at in the meantime, though, is there's a home health monitoring thing where we can give people equipment to say monitor their blood pressure, diabetes and things. And that way, if we see they're getting worse, you know, we can basically, we do have some emergency slots. Right now, we fill them up too, but we do have emergency slots we can use if somebody's in a desperate way. And we're working to get those freed up. So that's not a great system in a lot of ways, but it does allow people who've been waiting the longest to get the first slot.
Belinda, I had a question. So, you know, you're saying that year over year, it's over 30% of the investigative allegations are from caregiver neglect. Okay. As we look into the caregiver neglect, are we assessing the mental health of the caregiver? You know, is this a mental health issue, a lack of respite for the caregiver, mental health issues for the caregiver, and how can we better support caregivers?
That's a great point. And there really is a national movement to spend more energy and funding on caregivers. And I totally agree with you. In fact, I just talked to the caregiver group earlier this week. But when you think about this, you have to think about this from like an investigative standpoint. So if they go out, now one thing they do as part of their investigation is they determine the competency of the person that they're talking to. And so they ask some questions and find out, okay, is this person a good person to answer on their own situation? And so once they kind of assess those situations, they'll get medical records, they'll check, sometimes it's police reports, they pull all the data together. And then really what they're called to do is to make a determination, is this allegation is substantiated or not? Then they move into what can we recommend to get this person out of it? So the short answer is no, we don't do a behavioral health assessment of the person who is the perpetrator per se, but it would be in that report and it would follow through to the how do we get this person out of that situation? So that's kind of not the right answer, but in a way that is how the investigative process works.
Right. I'm just thinking it's the caregiver's mental health, right, is what's causing the neglect for the patient, you know, and then probably lack of respite as well is also another layer to this. And so I guess my question is, how can we better support caregivers through mental health and more respite? Because I mean, Children's Choice Waiver, you get 20 hours a week, you know, so I mean, mothers can work a real job if you only have 20 hours of respite, and You know, I mean, my son has autism and engages in self-interest behavior and, you know, it's exhausting, you know, and so. And what we pay caregivers per hour, like, they don't wanna deal with that. You know, they don't wanna deal with a child with autism and, you know, all you can afford is 20 hours a week, and so you can't work, you know, it's just a spin down. So I guess
There are respite programs. I'm not the expert on that. Certainly could get more information and bring it back to everybody, but there are respite programs that will allow, and insurance will pay for some of that. I do know that. But it's not an investigative process, I guess that's what I'm saying. Yeah. But no, I totally agree. And sometimes caregiver neglect is not, it may not be mental health. It may just be ugliness, you know?
Yeah.
And so we don't really determine why. We just say, yes, it was, or no, it wasn't. But that's a great question.
Okay, any more questions?
We have someone with a hand raised in the chat. It's Melinda Elliott.
Miss Elliott, you are recognized by the vice chair.
Thank you. Can you go down farther on this screen? So it says allegations investigated. That's not the same things as allegations substantiated.
That's correct.
Okay, so out of those, let's see, let me pick one. 887 caregiver neglects last year. How many were substantiated?
I'd have to get you the numbers, but we have those. If that's what you're more interested in seeing, we certainly can. But, and you could have, what I think they were trying to make the case of here is you could have emotional abuse and care neglect in the same case. But certainly I can get those on which, I think it's around half, but I don't want to guess at that. I'd rather get that number for you.
Yeah, I'd like to see a percentage too, if you can.
Yeah, absolutely.
Because half of it is a substantial drop. And does it change its that or any of the other, by the way, space in which things are worse than other things, if that makes any sense, or which things have more instances than other things, I guess is a better way to say it.
Okay, be happy to look into that. Like I said, overall, I think about half of our cases are substantiated, but I'll get that number, and we have it broken out between all the different types of allegations as well.
Great,
Yep,
thank you.
I'll share that.
I'm done. Thank you.
Is there any other public comment? Hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Department of Education. The chair recognizes Meredith Dorothy for the report.
Thank you. It's the light pink one. Yes. And so before I go through sort of some of the activities in the report, I've heard a lot about House Bill 1. And so a really, really great update there as far as the department's requests in HB 1. Listening to stakeholder feedback and a lot of things we've talked about here, Dr. Brumley has requested in House Bill 1 as part of our budget request, additional full-time staff for additional special education monitoring. And so I know that has been talked about, and we're something that we're really hopeful for, and feel really great about support we've received on that so far. So just wanted to share that since I heard a lot of mention about House Bill 1 and budget and requests. So wanted you all to know that he's being proactive in requesting some additional staff to get that work done. First, I want to update you all. We are in the process of still drafting our next IDEA funding application. And so I know we've talked about that a little bit here. We've talked about that with our state education advisory panel and getting input on their strong beliefs about spending and planning for spending moving forward. And so we have all of those documents out there linked to our website. I will say, we have not received from OSIP yet our next dollar amounts. So the application is currently drafted based on our amounts from last year. And that's what they advise us to do. Go ahead and engage in your public process and draft your application and engage in your public comment period based on your prior allocation. And so as soon as we get the next one, this is the latest that it's ever come out. So I don't know if we should be scared about that, because we have post-pandemic seen them every year give us an increase a little bit. And so as soon as we get the final amounts, then we'll update those in our application. And I'm hoping that it's soon, because we have to submit that close to the end of May. I believe it's May 20th every year, about the same time. And so that's kind of where we are with our next funding round. My next update is a SEEP update. So SEEP did meet in March at the request of Bessie and Dr. Brumley. We had a lot of stakeholders who came out to the Bessie meeting to talk about SEEP and ask about that process of submitting new applications and getting a new panel in place. And so we did hold a meeting in March. One of the things that we heard and understood was that stakeholders and the public wanted a place to talk about legislation. So you all know the department has to be very neutral on that. But we gave that platform at our March SEEP meeting, and they had a great discussion there around proposed legislation. We will next meet in June. I went ahead and gave you all of our dates moving forward. If something has to change, SEEP members know I don't like to change our dates, because I like for the public to know when they are and for them to be set. But if we do, we'll give plenty of notice if I have to make changes to any of those dates due to unforeseen circumstances. But you all can have those, put those on your calendar.
Who's going to be meeting in June? The new members of
The new members. So we have our application process that's closed. It just closed recently, April the 8th, and we will start our screening process. We introduced our new Bessie co-chair in March. Ms. Simone Champagne is our new Bessie representative that is a co-chair. We introduced her there. So she will be involved on this particular selection committee as we kind of move forward. So that's a great question, Christy. So that by June, we'll have our new panel in place so that we can't skip a beat and keep moving forward with our work. My next update is on our 2024 Special Education Parent Involvement Survey. We're required to do this annually. So each year we survey our parents who receive special education services for their students. The purpose of that survey is to get feedback. We actually report data on a couple of particular questions in that survey to OSIP as part of our annual reporting to them. And we use that information also to guide our efforts, improving services and results. So I have listed for you the chart of participating districts. So special education directors in these particular LEAs will receive random unique IDs that they will start to send out to parents very soon if they haven't already. There is a link, and I apologize, I did not link it here. It wasn't up when I submitted the report, but I'm happy to send it to Ebony to send to everyone. Any parent can also participate in the survey, but OSIP requires us to develop a methodology to select parents of students with disabilities that are representative of the students and demographics in our state. And so we go through, not me, someone way smarter on our data team, goes through and figures out the selection of districts based on demographics of students with disabilities to get a representative group for our survey that we report. So again, everyone is welcome to participate, and I'll send you that survey. And then the districts listed here in the chart are the ones that we submit as our representative sampling to OSIP. And that's the group that will be reported on next year. And so the survey goes through the summer. It'll be open until July 31st. It's open right now. I'll send you all the link today through Ebony. Our next update is around the kindergarten dyslexia screener. So we're getting a lot of questions about this right now. And I completely understand that a student with dyslexia is not always a student with a disability, but this work lives on my team. So we support, I have dyslexia specialists on my team. And so this is where this work falls within the department. So we are right now in response to Act 266, we've had dyslexia legislation in our state over the past several years, and that's common. This is a national interest, something that's really growing, how we identify and support those students in our state. And so this is something even nationally that we see increased interest. And so Act 266 required the department to select a dyslexia screener at no cost for all of our school systems. And we are required to screen students, kindergarten students, in their second half of the year. So by the end of May, every year from here forward, kindergarten students will receive that screening. That screening will give the teacher an at-risk or a no-risk designation. It does not mean that student then that is not an automatic qualification for a 504 plan or an IEP. They would still go through 504 processes for additional assessment and evaluation, and that SBLC team would determine what additional assessments and what support that student then needs. So there were a lot of very specifics within that law, so I listed them here. We were subject to the provision of funds. So we received approximately $100,000, just over that potentially, from the legislature to fund this particular screening. So we've been working through state procurement processes. We have procured a screener. We are working through now the rostering, because our school systems are also going through their end of year literacy screening. We are doing LEAP testing. And so we want to make it as easy as possible on our LEAs to administer this screening. So we want to get the rostering right before that is sent out. So it's the least amount of additional work on them as we can make it. And so we're hoping those rosters go out either this week or next. We are extremely close to getting that rostering right for school systems to make it easier on them. And then they'll have, like I said, through the end of May to get their kindergartners screened for dyslexia. I'll also say that does not mean that at any other point that's our state law required screening. That doesn't mean that at any other point, if there's a parent concern, a teacher concern, that screening couldn't happen in other grade levels. We know we still have students in middle school and high school sometimes. They don't get identified until they get in middle school or high school sometimes that they have dyslexia. And so it's not to say that a student can't get screened if there's a concern at other grades. But we are now required to do it by the end of by the end of kindergarten. So I wanted to just give that update, let you all know where we are. We're very close to administering that screening. And then if a student receives an at-risk, the parent will be notified within 30 days, right? And so we know that some of that notification for this year, this should only impact, first year implementations and rollouts are always tough. But some parents, right, some school systems may be using all the way up through the end of the school year. So some parents may be getting some notifications after school. They have 30 days to get that notification letter to parents. And we've made it pretty easy. The system will print. There is a letter that will print for the parent for the school system to send out. So trying to make it as efficient as possible for our school systems. And next couple of items, we have, you all know, when I came on board, I started back our in-person capacity building sessions. We call them collaboratives for our special education directors. On Tuesday, I had nearly 100. So that tells you we have, that I also get some charter schools, right? Charter school special education leaders, which are great, coming to our sessions to get professional development. So want to always update you all on those because they're very important to me. We have gotten extremely positive feedback from the directors that they like those networking opportunities. They like the support and the training that we're giving them. So just an example, and I, want you all to know, I know I tell you this all the time, but I feel like I've got to be transparent and give you examples of how I do it. In listening to you all's feedback in these meetings, I get to take that and then say, okay, what do our directors need based on what I'm hearing? Based on trends that we're seeing happening in our state or knowledge that needs to be built. And so, we've got a lot of end of year processes coming up and summer learning processes coming up and planning happening. So one of the things that we took the time to do this week was really go back to some basics with them and talk about extended school year, right? We've all talked about that here. How do you qualify? How do you determine eligibility? It's not a one size fits all, it's individualized. So we really go back to basics. And so I want you all to know that I'm continuing to listen to you, take in those suggestions, take in those concerns, and turn around and take that back and help build capacity for our leaders leading this work in our school systems. Last, we have a lot of end of year reporting that happens this time of year. One of the things that we're going to be launching, and another one I didn't put on here, but I just covered this with all of our leaders, so it's fresh on my mind. We're launching 2 actual reporting collections right now. So you all know that every year they have to report their local Special Education Advisory Council report, where they're reporting on all the activities that local SEEKs are doing across the year. Many of you serve on your local SEEKs in your areas. And so we're launching that report. We also took feedback and stakeholder input. I involved SEEP with this. You all told me this, that you would like to see some consistency on those reports. And so we have shared a template. Now, I will say House Bill 153 will require some additional reporting. We've had a lot of conversation about that. They submit those reports, but there's nothing in the law that requires certain things that maybe you all want to see as the public and transparency from your local school systems. So we have already shared a template with them, but no, I will have to update it. If some of the I slipped some of those things in because I do think some of them are good information to include in an annual report, but I'll make sure if that House bill passes that I get, make sure all of that information that would then be required is in my template. So I really appreciate the feedback. Steve did a great job and gave a lot of great feedback about what you all would like to see as the public and as parents be placed in those reports. So we're launching that. They'll give me those reports by May. We'll compile them, and then I bring those in August to to my state panel. And I believe I also brought that to you all last year. I'll do that again. So at our fall meeting, I'll be happy to bring those here. And then we're launching again our special education camera data collection. So wanting to know and being good stewards of the legislative funding that supported the SPED cameras, how much money did they spend this year, how many cameras were requested, how many cameras were posted. And I also provide that and report that to Bessie, and I'll of course bring that to you all as well. So I know we ask a lot of our school systems at end of year and all year, but I know it's a really busy time for them. But those are just a couple of major things that that we have going on right now. And I already talked to y'all last time about Teacher Leader Summit. We have the Human Development Center folks coming to talk about FASD. So I think that is wonderful partnership and really starting to address awareness at least for that. And we've got over 80 sessions that are really geared towards students with disabilities, and we'll be able to impact over 7,000. We've expanded this year, over 7,000 educators and leaders will be with us in New Orleans at the end of May for that event. So pretty excited. That's really a lot of work happening on our team, prepping and planning. My full team is presenting every single session back to back, so we're gonna be worn out, but it'll be a great thing. And I'll take any questions that anybody may have.
So what resources do we have for children with dyslexia? So they're going to be identified, and then what's next? And then the second part of the question is there a correlation with dyslexia and the fetal alcohol syndrome that Dr. Phil interested in?
There are visual implications and auditory more than visual, but there's it's a spectrum disorder. So just like your son on an autism spectrum, it's not not every kid that's impacted by prenatal alcohol exposure is going to have visual issues.
Yeah, and just to kind of elaborate a little bit. And so one of the things we have to do as a state is have a really clear identification process for dyslexia. So we have an at-risk screener now specifically for dyslexia. Prior to this, school systems were using the universal screener, which is DIBELS, and they were using that. And so if you were well below, they were then instructed to do some additional testing to screen for characteristics. We're now matching the law language of at risk, and that's what the screener, the language they use is at risk. And so once I get an at risk screening, all of those students will go to SBLC, and SBLC will do further core assessments. They will decide, okay, what is the reason for this at risk? Is the student still progressing? Are they going back to the school, back to the educational setting, back to the classroom with additional reading intervention and literacy intervention? Or do we feel like we need to move to a formal evaluation process, either for services under a 504 plan or services under an IEP as a specific learning disability with that dyslexia as that area of concern? One of the things that law and policy talks about is that multi-sensory language program. So having a very structured phonics-based literacy instruction. And so we define that in policy. We are still developing a lot of resources. We have a lot of new FAQs coming out, and we have a new guidance document coming out. And we have multiple sessions at Teacher Leader Summit because of an increase in awareness that we can also launch at Teacher Leader Summit and then make more widely state available as well in terms of.
So there really isn't a operational process that every school should follow right now.
Yeah, right. They have an identification process. Yes, that's outlined in
just the identification, but not the next step.
Right. Correct. Yeah, we have way more to do around best practice, instructional strategy, that kind of thing. Yes. But those kids who have those plans, they're getting some very specific accommodations and supports if they're served under a 504 or under an IEP. But yeah, we have more to do.
Well, and I'm just wondering, how many special ed teachers are trained in dyslexia to help these children?
Absolutely.
So yeah, funding for that to provide these teachers with that training and education to help these kids that we're farming out.
We're on our second cohort of dyslexia therapists. So we are trying to place more of the therapists and practitioners across the state. But to your point, next year we're looking at already, how can we provide, right? I can only take 25 in each of those cohorts. So we're going to have 50 pretty soon that we're placing across the state. But statewide, what can we do to build capacity around dyslexia support and best practice strategy? Yeah, so there's more to do for sure. We're doing some, but there's more.
At least on the radar.
Yeah, absolutely. Absolutely.
Quick question, what age group or how young can the screener, the kids, you know what I'm trying to ask?
So, yeah, so a lot of our pupil appraisal professionals don't recommend that you go much further back than kindergarten. There are differing opinions on this. There are some who think kindergarten is too soon. Previous policy that we just changed to match law was between kinder and third. And most were waiting till first or second grade, so they had some leeway in when they were screening.
I was just thinking, because we do a lot of screening for 3.
Yeah.
I didn't know if that was
Yeah.
something we need to get on it, right?
Because they're still really picking up those foundational literacy skills that early. No, not many would recommend going prior to kindergarten. Good question.
Thank you, Ms. Meredith. Are there any public comments? Right. Since there is no public comments, the report requires no action and will be placed on file. Would council members like a break? If no objection, the meeting will recess for 10 minutes. Hearing none, the meeting is at recess. It is now 2:50. We will reconvene at 3 o'clock. The next item of business is the report of the Governor's Office of Elderly Affairs. The chair recognizes Sherry Crane for the report.
She's not here today.
Oh, she's not here today? Okay.
She didn't send a proxy.
Okay. The next item of business is the report of the Governor's Office of Disability Affairs. The chair recognizes Jamora
Ennis.
Ennis. For the report.
Hello, everybody. I was getting a process of getting some coffee, but. All right, so I'm happy to be here. For those who don't know me, my name is Jamar Ennis. I've been working for the Department of Disability Affairs. I started back in 2009 as assistant director. Started out as a program coordinator, then assistant director. I left during the pandemic to work for the statewide independent living council, and I was offered an opportunity to come back, so here I am. So I'm not as pretty as Bambi. I have some big shoes to fill, but I'm here. We do have a report, so it is the green sheet of paper. So this was done prior to my official start date. So there are some slight deviations. So I just want everybody to know that the Landry administration, we have an open door policy. If there's anything, issues, concern, legislation, my contact information is on the report. Please feel free to visit me, call me, email me. We want to know about issues, concerns, especially with this council. We want to do the best job we can to serve our constituents. So I know that we're in the throes of legislative session right now. So we just anything that we can to hear the issues that we're here for that. This is what we signed up for. And another thing, we're in the midst of planning our GOTA conference. We're still trying to determine the date and how long it's going to be. And that's something that we definitely want to do. We want to have a diverse selection of topics, whether it's for education, accessibility, to offer to kind of keep the tradition going of information sharing. We do it around the anniversary of the signing of the ADA. Is generally how we try to do it. So we certainly would like, we'll probably be listing out a request for proposals or request for participation for any of your agencies who want to present. We'll be happy to have you. Also, we have some updates relative to the GACTA Council, which is the Governor's Advisory Council of Disability Affairs. So we are taking applications. We have a significant reduction from 31 to 9. So we do want to have anyone who's interested in applying to apply. The applications are open. Our next meeting won't happen until June 19th or June 18th. It's usually the third, and forgive me, it's only my second week back. It's usually the third week of the, of whatever quarter it is. But certainly we want, all interested parties to apply for our council. And if you haven't met our assistant director, his name is Liam Doyle. He's from Lafayette. He was a former employee of the Lafayette Consolidated of Government. So we just look forward to serving and working for this administration and for you. And I know my report has some other things in there, but I just want to kind of use this time to kind of just serve as more of an introduction. You know, I look forward to getting to know everyone on this council and working together and doing some good work.
Any questions?
Jamar, you'd mentioned, you're planning some, conference or work of some sort, you know, one is when it would be, and second is who's typically the audience at that conference?
It's a good question. So generally we be planning around the signing of the ADA, which is around July 20th, or somewhere around there. We're considering doing a hybrid of in-person and virtual as we've done in the past. And the audience is, you know, of course, it's free of charge. Anyone could attend. We certainly want as many participants from representing the disability community as possible.
So I guess my question really was thinking about your invitation to, you know, our staff have a wide variety of things that they do, and I don't want to have somebody come do a presentation to physicians if there's no physicians there, for example. If it's mostly self-advocates, parents, professionals, a mix.
This is the same conference that Bambi would put on every summer. So just a continuation of.
Yeah, I've not attended that conference.
Yeah.
But the
Of information.
And LSU is represented a few times. But we may be wise to just do a temperature check to see what would interest our constituents in our community, just to have. We try to do things to what's going on, I guess, this year. We often have themes. For instance, during the pandemic, it was mostly pandemic themes. Whenever we were kind of easing out that pandemic phase, we were, you know, we kind of themed it on the pandemic was on the horizon. This is kind of how we're getting back to business. So we're gonna put a lot of time and thought into what we're gonna do and how we're gonna do it. And of course, we're open to input from everyone. So I'm glad you asked this question. So they can kind of get us thinking a little bit more about what topics are gonna be presented this year.
Any public comments? Oh, so I'm sorry. Okay, Madam.
I just want to say, welcome, Mr. Ennis, welcome back. And I've seen Liam's been coming to our seat meetings as well. And so I've still felt presence and look forward to working alongside you all.
Thank you.
Nicole?
Okay, I see the information up on Mr. Liam, but do you have a phone number that you can use that?
Yeah, I do actually. And again, this report was created before I started, so so I'll give everybody my cell phone number and my landline. I still have
Not many people have that anymore.
My landline is 225-219-7547. And it was also Baby's old phone number too. And let me give you all my work cell phone number, which I don't know by memory yet, so please forgive me. My phone dies.
Oh, I'm sorry, you have a public comment, Jamar.
Yes.
Repeat your phone number.
The main line is 225-219-7547.
Thank you.
And I'll give you I'll send my cell phone and my fax number, and I'll circulate that somehow. I'll make sure everyone has it.
Awesome, thank you.
Any public comments?
That was it.
That was it? All right. This report requires no action and will be placed on file. The next item of business is the report of the Disability Rights of Louisiana. The chair recognizes Tori Broka for the report.
Hello, my report is the lavender one, and given that we are running late, it has been suggested to me that I can perhaps just refer you to the report and answer any questions, which I would be happy to do, because I am always happy to not have to read a report. So here's the report. If you have any questions about programs, anything we're working on, please ask me, and if you don't have any right now, please feel free to contact me at our office. I'll give you any questions. But yes, Jill.
Okay, so it would take just step by me then and say, here's your report, and I answer the question.
Sure.
Is your work following up on the lawsuit against first responders in Jefferson Parish? Is that there some suit?
There might be. I don't think that's one we are working on right now. So if other attorneys say, it sounds like something that would be a private law firm, like somebody is suing, or somebody is a private law firm suing public first responders in Jefferson Parish.
No.
As far as I know, it's not something we're working on at all. And if it's something that's, a private law firm is working on, representing plaintiffs, we would generally not be involved with it.
It was the one about I heard you and Julie talking about it in January. I don't know.
I will get with our legal director, ask her if we're doing anything regarding that, and I will get back to you with an email.
Cool.
Awesome. Cool.
Any public comments?
No public comments.
It was like a first responder. Brendan, what am I talking about?
Fire. The report requires no action and we placed on file. The next item of business is the report from Families Helping Family Centers. The chair recognizes Kristen Reed for the report.
I'm gonna make mine quick and simple. Mr. Sprinkle could not be here today, so I came in his place. I am the deputy director at the Families Helping Families at the Crossroads in Alexandria. So as you can see by the handout is on the thing, we've been very busy this first quarter of this new fiscal year. All of our centers right now are, as Patty had mentioned, working on our RIWs, our resource information workshops for the region. We also have, it's IEP time. It's almost the end of school year. They're getting ready for IEPs for next year. So we are really working hard on that. Individually, as far as Region 6 is concerned, because that's where I'm from and that's my pride and joy. But we recently held our RIW. We were actually blessed to have 142 participants. We are focusing on right now our transition fairs in our schools with our regional partner with the parish school boards to do the transaction fairs for graduating seniors, what they're going to do when they get out, where they're going to go. We've been incorporating, I think we are unique in that We are looking at other things that they need besides just, are they gonna go to community college? Are they going to college? Are they going to the ARCs? Where are they going? We are having those conversations about guardianship, because there is nothing worse, y'all, than a parent calling and saying, she's left me, I don't know what to do. She's over 18. She's a competent major. It's very hard to, do those services. So we're having all those conversations out in the communities. We are also, we have been very blessed. We just recently had 2 of our gumbo meets. That's for visual and physically impaired children, our practice events. We had 110 athletes in Shreveport. We had 166 in the Monroe area. We are going to be doing more throughout this year as far as doing that. But right now, one of our main focuses for Region 6 is to get people out of their homes and back in the communities. Everything that we are doing right now is we're really promoting in-person base because, it was all fine and good when it worked, and it worked very well. But now, some meetings are so important that nothing but face-to-face works. That gets your point across, the emphasis, what you're talking about. It keeps your attention captured. It keeps their attention captured. We are working on legislative visits, Capitol, Yellow Shirt Days, really pushing out the information there because, of course, we're asking for money for families helping families. So, of course, we are looking at that, but also the flexible family funds and the waiver night supports rate. We're going to continue to keep up the good work. And so, thank all of y'all for your time.
Thank you, Ms. Reed. Do we have any questions from council members on her report? Any public comments?
No.
All right, the report requires no action and we placed on file. The next item for business is the report from Office of Citizens with Developmental Disabilities. The chair recognizes Julie Foster Hagan for the report.
Good afternoon, everybody. Our report is, I don't know what color, but it's the book that's in your folder because ours is the yellow, thank you. And so I do know that we have the first several pages are just are different data points that the council has asked us to provide through the years. And I know we have some new council members, so I will make an offer. If there are any council members who would like for me to take some time to dive into really explain what this data was and where that came from, Ebony, I'm happy for if you and your team, if there's members who would like for me to do that or new members, I'm happy to do that outside of the council meeting because we could talk for an hour just about the data. So you can continue to scroll. Oh, I'm sorry. Okay. Yeah. So I'll just highlight a few things, and then again, I'm happy to take some questions. On page 7 is where we have some information about employment. We've been doing a lot around employment and day services and the services that are provided there. I'm happy to announce that as of April 1st, we now have all of our services, day program and employment services aligned across all of our waivers, and the rates also aligned across all of our waivers. So that includes some previous services that we had. We used to have some things in the supports waiver, but then they weren't in the row or the new opportunities waiver. And so we've been working in the last probably year and a half or two to get those services aligned across all of our waivers. So as of April the 1st, I'm happy to say that we've got that accomplished. There's still some misinformation and confusion around that since we just started it. So we are planning trainings for our support coordinators and our provider agencies to make sure they all understand the codes that we have, what the service is, so that they can help make sure that people receiving services and their families better understand that. If you keep scrolling, I also will just hit a couple of highlights in terms of the American Rescue Plan Act. You can see all of our activities. And as Mindy mentioned earlier, we also have the rate methodology. That one is not in this report because we just got the approval, but we'll add that along with updates on there. I did just want to point out a couple of things. So we've been working for a while now with the START team, who specializes in helping states do scans and come up with strategies to address gaps in services for people with intellectual and developmental disabilities. and co-occurring behavioral health needs. And so we were hopeful that we would have our report by April. However, when they went to do the report, they looked at all the surveys, and we've blasted out survey opportunities through Developmental Disabilities Council and some lots of other avenues. But we wanted to make sure, they felt like they didn't hear a lot from people with lived experience themselves. So they heard a lot from families, but not a lot from individuals with disabilities. And they also felt like they had not heard from people, didn't have enough representation from people in rural areas, as well as our behavioral health, some of our behavioral health providers. So they came a few weeks ago and we scheduled some additional meetings. We have one more that the team is going to be talking with Meredith and some of her folks in the Department of Education. So we have that. And then once we have those final meetings scheduled, we do anticipate getting a report pretty quickly from them, which we plan to make public, and we plan to use it as a working document for us to be able to then really look at what are some strategic things we know that we can do moving forward. The other thing I'm really excited about that I'll have more information for, because we're really just starting with this, but we've been talking a lot about technology and adding technology services in our waiver. There's still just a lot of confusion about what we mean when we say technology. And that's not even just in Louisiana, that's nationally. People talk more about telehealth, and telehealth is a service. And then assistive technology are more your devices that you can use to help. And then there is, kind of more remote support and remote monitoring, and those are different things. So we're really working on trying to make sure that we're using consistent language when we're talking about those things, so that it can be clear. But we're really excited because several of the local governing entities agreed to partner with us, because a lot of people just said, we don't even really know what what are you talking about? What equipment are you talking about? What technology are you talking about? I'm not sure if it works for me or not, because I don't even know what the possibilities are out there. So some of our team is working with some of the different local governing entities, so that they can have, on site throughout the state at different locations, a place where if people are interested in using technology, they can go there. They can meet up with members from Latan who can then do demonstrations of what the different technology is. That way we're not spending money on things that aren't working for people, but we're also letting people know what these things are that might be able to help them be more independent, in their own home or out in the community or at work. So we're really excited about that. We're working now to determine which equipment we're going to have in which areas, and anticipate that to roll out in the next few months. Early steps, just to share with you guys, the only legislation that OCDD is specifically asked for this session, we have the statewide Interagency Coordinating Council, SICC. It's federally required that we have this council, and it's to help inform what we do in our early steps program. That SICC council has been under Governor's Office of Disability Affairs for some time now. And when we started looking at how that functions in other states, we learned that we were one of only 3 states where the agency that operated the program wasn't helping to monitor that coordinating council. So only Louisiana, Alaska, and Wyoming, we were the only 3 states who had the SICC somewhere else. So it is in legislation that it be under the Governor's Office of Disability Affairs. We worked with Bambi before she left, and welcome back, Jamar. Worked with Bambi before she left and the Governor's Office, who were in agreement with just it moving. All of the SICC members, just like the Developmental Disabilities Council members, will be appointed by the governor. So we won't have any input or influence over who those members will be. We will simply just help coordinate meetings and have the staff that are responding to the requests from the SICC, if in fact this passes through. It has been presented by Representative Lyons passed the House floor, and we'll now be hearing that, I believe, next week on the Senate side. And then finally, just want to really do a recognition, and I'm happy, I don't think this was in our report, but I'm happy to share the links. Our OCDD Resource Center has been working with some other states and national folks to develop some resources for people for people with intellectual and developmental disabilities and behavioral health needs, actually for those providers in the community, your healthcare providers, to better understand how to support people with IDD in their practices. But they've also done a lot of work around wellness, and we've published several tools and resources for wellness that are geared for families and for providers and direct support professionals. And they've gotten a lot of national attention, and a lot folks that have reviewed these feel like it's very helpful instruments. We're also internally looking at how we make sure our own system has access to all of these tools. So some of those things just came out within the last month. So we will definitely make sure that you guys see all of those resources. And I will stop there, but happy to take any questions folks have.
Any questions from the council?
Yes. Hey, Julie, it's Liz Gary. I just have a quick question, and maybe I hope it's quick. This son assessments, getting a lot of feedback from families stating that they're being told that there is zero and that they can get all the support they need from EPSDT. And I just wanted a little bit more to wonder if the screening has changed. And I know TEPRA did come in, which did give a lot more families the opportunity to have the EPSDT. But my concern is that there are a lot of families who need the support of a waiver more for being out in the community or taking their children for the caregivers to take the children to therapies and things like that. And I do not think that can be done under EPSDT, which is causing more problems for the families.
Yeah, so we had gotten the same concerns, Liz, and nothing changed with the sun screening. There has been some recent clarifications in terms of needing to make sure that we're following the federal mandate, which requires that we try or that we employ state plan services before we employ waiver services. But to your point, one of the things that we're working on making sure we clarify within the system is there are things that can happen in EPSDT and then things that can't happen in EPSDT. So if what you need is someone in your home providing those personal care services, that looks different than your community services. So we are making sure, I think that when we clarified, we have to use state plan services first. There's some additional clarification we need to do to make sure people understand for EPSDT, PCS, and long-term personal care services, what those services do and what those services don't do. And so we are working on getting that clarified and that information out to folks.
Great, thank you.
Could you go explain what is the community life engagement? What does that involve with the day programs?
Sure. So before COVID or before we had this service, typically what would happen, or not in all cases, but in a lot of cases, people would go to a day program and they would stay at the day program most of the day. They may occasionally go out in the community for an activity, but they were primarily receiving services there in a campus, in a facility with other people with intellectual and developmental disabilities. So we developed, and some providers helped us with this, because what they started doing is, instead of having people come to a facility, they started providing services out in the community. In order to do that, so if you're in a day program location, then you would typically only have one staff for 8 people. If you were going to do services in the community, you need a smaller staff ratio. So with community life engagement, it can be up to one staff person for up to 4 people, but those services all have to happen in the community. So a lot of providers have just found different locations that they go to in the community. Sometimes providers might have people who go to a site maybe 2 or 3 days a week, and then they would bill the regular traditional day service, and then they might spend 2 or 3 other days out in the community with that higher staff ratio. And at the time that they're providing the services in the community, which are your day program services, so you're trying to help people be more independent, you're trying to connect them with the community and all of those things that you do in day program, but it just happens out in the community. And so the rate is higher because there's an expectation that you're going to need more staff to be able to provide that service.
Bill?
Hi, Phil. Two things I wanted to ask you about. First is what are we calling this now? The 5 parts of the individual supported employment services. It seems that I'm guessing this might take place through a person-centered plan or something outside of these employment services, but I don't see listed here any sort of evaluation, assessment, whatever that might be, to determine what the individual's interests might be. And, we've lived through decades and decades of sheltered workshops and so forth. And even when we started in supported employment, everyone started their first job was to be a greeter somewhere or whatever, but that doesn't work so well if you're really interested in helping people find work that's meaningful and enjoyable to them. So I'll stop there, and then I would like to ask you another question after, if you can respond to that.
So as it relates to that, there are services for assessments and things. There's some discussion through the person-centered planning process. You are correct, where you're talking about what they want. But those 5 bullets that's not all the employment services. Okay. Those were the ones that were different across the different waivers. So you might have one in one and not in another. And what people were telling us is that it was just really hard to even be able to share. So there are still those services by all means that are helping people. Our goal for anyone who wants it is to get them true, competitive, integrated employment where they don't really need any of these services. So that's our goal. And to that point, Phil, yes, you have to do assessments and you have to be able to link folks to the right jobs. So what that is just explaining is where we've now aligned them across our waivers, but there are still those other services in place.
Okay, I kind of assumed there would be, but it did sort of jump out at me. So the second question I have really is more about if we're really trying to do some systems change work here. Obviously, if you're a provider, you're going to be incentivized to do those things that are going to capture the most reimbursement, right? So when I see that I can do a 1-to-4 ratio of doing things like taking 4 people out into the community to do something together, and I don't know what that dollar rate is that the provider is getting reimbursed for, but let's compare that to if I'm really doing employment, I'm probably doing more of a 1-to-1 ratio, maybe 1-to-2 from time to time. But if I'm really doing competitive integrated employment, that's kind of the difference there. So in the past, one of the reasons why we've not made as much progress on breaking down some of the sheltered workshops and day hab and all that is that if I'm a provider, I can make a lot more money providing group services than I can individual services. So without necessarily asking the dollars and cents on all this, which may still be not firmly established, has that been taken into consideration? And is a provider going to make more money by providing services that are going to result in that individual getting a job, or are they going to get more money for taking 4 individuals out and being reimbursed for all 4 of those people, add that up and it's like, oh, yeah, I better not do all competitive employment, oriented work, or I'm gonna go bankrupt.
Yeah, no, so the rate is, I don't have it off the top of my head and I don't have it in here, but we can get it for folks. So one, the rate is much higher. There is the ability to do one-on-one in like a career planning and some of those kinds of things. So thinking about really trying to get people to the individualized part, there is that one-on-one. There was no increase. So the services that are provided in the day program with a 1-to-8 staff ratio, there was no rate increase for those at all. The only increases or additional funding we looked at were for those things that are provided in the community. And there is an offset if you have smaller groups, even more of the 1-to-1. And I don't have a lot of the details because I wasn't involved in this, but Rosemary Morales and Charles Ailes in our office, they actually had multiple meetings over the last 1.5 or 2 years with the day program and employment providers across the state as they built the services and as they built the rates, to be able to have frank conversations about what you just said. We don't want to incentivize large groups of people going and sitting in a place. We want to incentivize true community. And we have some providers who do very well at doing that. So we made sure those folks were already at the table, and then we structured what does the rate and the service definition look like. So yes, they considered all of those things as they move forward with the system change.
Yay, thank you.
Okay, any more questions for Julie from the council? Rikita, any public comment?
No.
Okay. Next, on this required no action, so moving forward, and this report will be placed on file. The next item of business is the Human Development Center. So the chair recognizes you, Dr. Wilson, for your report.
Well, thank you very much. I wish I had a short report, but it's actually going to be about 2 hours, so.
Well,
No, following the lead of my 2 or 3 people before me, I think that our information's in here. I did talk a lot about FASD earlier, but we are doing lots of other things at the Human Development Center. And I encourage you to look at our report, and if you think we're not doing enough of something, or we're doing something that you really think is great, please give us some feedback, give me some feedback so I can give our staff feedback. But otherwise, like Tori said, it's in here. I'm here to answer any questions you might have, but I'm afraid if I take more than 10 more seconds, there could be a mutiny.
okay, any questions? Everyone's hand goes up at once. Thank you, Dr. Wilson. No more council questions, no public. Rikita. Okay, Nicole. Okay, so at this time, we will have public comment. Rikita. Sorry.
I have one thing real quick.
Yeah,
if we could talk about it next time, or maybe people text. We seem to have a lot of people interested in working on the transition guide. So I'll send out some things to staff if you send it out. And then maybe next time we can talk if we want to do like an ad hoc meeting or something to maybe see what we need to get that. I don't know if I need to make a motion or whatever to do that.
No, I think whenever we are creating the solicitation for proposals, we can get those ideas from you and make sure that that information is included. So whatever contractors are interested in applying for it, they know specifically what the council.
What the council is. Okay.
Can I ask just quick, when do those solicitations go out?
So after today, we have to put the plan out for a 45-day public comment period. After that time, then we'll be able to move forward with the SOP.
Gotcha. All right.
So, okay, so no comment in the chat. Thank you for your comments, questions, and this time, Ebony, any announcement?
Yes, so council members, please don't forget that your financial disclosure forms are due May 15th. Oh, and for any new members that have not been Senate confirmed, I know that Marie Lively and, I can't remember what committee she's on, but she's with the Senate. She's been sending out information to make sure you fill out your questionnaires and your background checks. So if you haven't done that, please do that. Get the questionnaire notarized and submit it to Senate so that you can be confirmed. We've gotten word that the session will probably end early because they're looking at doing a constitutional session. So we want to make sure that we get those documents into Senate so you all can be confirmed. That's for new members. And then our bylaws chair has asked me, I know some of the members weren't here for the January meeting because of the ICE situation. So if anybody is interested in volunteering for the bylaws committee, you can let me know and I'll let Christy know to appoint you all. Is anybody else interested? I think we only have 4 members right now. So you're interested in the phone?
Okay, what's it though?
Bylaws committee, yeah.
Reviewing them.
You're already on your own. Oh, are you interested in
Yeah.
phone? Okay.
Ebony.
Cause I had work with her billing in Orange.
Yes, Lauren, yes.
I'm not on it.
No, Eric, but if you're interested, you can definitely be added.
No, that.
Okay.
When, point of clarity or question, when I was chair of the membership committee, I thought like I appointed the volunteers of what, okay.
Christy, the chair, she makes all the appointments. Yeah.
Okay. Cool. So I got Nicole Banks and Eric Taylor.
Mr. Tony Piontek volunteered as well, Miss Melinda Paradin, Nicole Banks, and Angela Harmon. They all just volunteered.
Angela, I definitely did forget you. You're welcome. All right, so.
Are you
Okay.
interested?
Yeah.
Debbie,
Is it in the bylaws committee? Okay.
oh, wait. This is still small enough that I can make motions, right?
I'm gonna refer to the parliamentarian. It was less than 12, right, Nicole? Correct. Okay.
Okay,
We're at 10, so you're good, Jill. You're good to make recommendations.
going once, going twice. All right. Okay, thank you to all those. Okay, so any other announcements, Ebony?
No, just that the next council meeting is July 17th and 18th, the same days, 17th and 18th, but in July.
Okay, yeah, so with that said,
Oh, Jill, I do have one more thing. If everybody can please look in the back of your packets, there are surveys. The council staff and I work really hard to make sure these meetings run very smoothly, but if you notice anything that we can do better, please let us know, and that's food and anything that you can think of.
We know you're all gonna say it's cold. I already know this is gonna be on there.
It is.
Okay.
I was just informed by Mimi Webb that this morning we got, action, y'all, I'm not trying to prolong it. Yes.
Action Alert 12 just came out today. We have a yellow shirt day for Tuesday. I believe the call is 8:30. So it's, check your emails, everybody. It's in your email. If you can make committee meeting, house appropriations, 8:30 at the Capitol. Tuesday morning. So, but all the details are in there. It's the house appropriations during the budget. And we need that money added in. We need to make sure and shore up that, you know, we know what your ask is and all of that, and that we need this money and the funding so we can find it. And then we just show up and show out. So yellow shirts. Hope to see everybody there.
Miss Mary has her hand raised. She would like to
Yes,
speak.
Miss Mary. Yes.
About the yellow shirt day, what day is that again?
It's Tuesday, this coming Tuesday, 8:30.
Okay, thank you.
So any more comments, questions, concerns? Okay, okay, hearing none, if there is no objection, we will convene this quarterly meeting of the DD Council. Okay, hearing no objection, this meeting is now adjourned. Thank y'all. See y'all.
Thank you.
Have a party now.